Hello, I'm Dr. Edward Neilan, and I'm the Chief Medical and Scientific Officer at NORD, the National Organization for Rare Disorders. 39 years ago, the founders of NORD were instrumental in the creation and passage of the United States Orphan Drug Law, which has greatly expanded the development of treatments for rare diseases. Today, NORD, a nonprofit organization, represents a federation of greater than 130 member organizations, and we continue to fight to improve the lives of all rare disease patients and families by advancing rare disease policy, education, research, and care. Today, I'm very pleased to give you an update on one of NORD's newest initiatives, our recent designation of a nationwide network of NORD Rare Disease Centers of Excellence. While some progress has been made in the US and elsewhere, rare disease patients, caregivers, and clinicians continue to face an array of difficult challenges, including, for example, the small numbers of medical experts in these disorders, the long diagnostic odyssey that is typical for rare disease patients, and the lack of approved treatments for most of these conditions. Solving these problems is going to require even more robust collaborations between stakeholders. That need for further collaborations is at the heart of NORD's decision to select, designate, and partner with a nationwide network of NORD Rare Disease Centers of Excellence. What do we want this network of collaborating centers of excellence, or COEs, to do? Two things primarily. One, help patients who are struggling to find answers identify centers with deep expertise in rare diseases for faster diagnosis, improved clinical care, and/or connecting them to researchers in clinical research studies. And two, catalyze collaborations between the COE sites to work on the many clinical, scientific, and policy problems facing rare disease patients, which cannot be addressed by a single medical center acting alone, by sharing expertise and working together to find better solutions. What will the benefits to patients include? An ability to search for an appropriate center of expertise across the designated network, access to medical expertise and consistent, high-quality clinical care, reduced time to diagnosis through pooled knowledge and expertise, pre-identification for and participation in research studies, expedited navigation to find community-provided resources and support, access to educational programming provided by expert clinicians, and all of this facilitated by meeting patients closer to where they live. These and other benefits to patients will be realized by supporting each center of excellence with access to shared knowledge and resources, such as clinical protocols, diagnostic coordination, advocacy assistance, innovative technology, researchers, and educational materials and programs. How are we building and enabling this collaborative network? NORD's COE model envisions three key steps to improve results for patients. One, selecting a network of centers with high clinical capacity and expertise. Two, interconnect that network through shared knowledge, standards, and protocols. Three, leverage the network to create a patient-centric model that focuses on developing best practices, better patient education, better physician training, and more and better research for rare diseases. NORD's process for selecting and designating centers of excellence involved an extensive application, including more than 120 questions and targeted interviews. This application and review process sought to identify medical centers with key shared qualifications, including a commitment to rare disease patients and their families, coordinated multi-specialty care, support for the transition from pediatric to adult care, education and training of students and medical professionals in rare diseases, and actively contributing to rare disease research and new models of therapy and care in rare diseases. In November of 2021, after the completion of the selection process, we designated 31 NORD Rare Disease Centers of Excellence, which are listed here alphabetically by state. Although chosen primarily for their strong rare disease programs, These centers are also very broadly capable. Of note, although these 31 centers represent only 16% of the 192 medical schools in the United States, this group includes, amongst other past recognitions, 10 of the top 14 medical schools as ranked by US News and World Report, and 8 of the top 10 US News and World Report children's hospitals. To encourage further collaboration amongst the rare disease experts in this network, NORD is providing coordination and resources, including, for example, online IT resources and meeting platforms, in order to realize our vision that, linked by a shared collaboration platform and frequent virtual meetings, NORD's network of rare disease centers of excellence will create rich opportunities for sharing clinical expertise, faster diagnosis, collaborative research projects and clinical trials, often led or initiated by one site, but that whenever practical, will be spread to other sites in the network. While NORD has some specific projects in mind, we expect that many of the best ideas will come from the COE sites themselves. This includes the development of new best clinical practices, including, for example, treatment guidelines that can then be quickly shared across the network and beyond. These efforts overall leading to improved outcomes for patients. Although our site designations were only made a few months ago, we have begun to make progress building this into an enthusiastic and collaborative network. A common membership agreement was signed by all 31 sites and by NORD. Then on November 4th, the list of sites was announced in coordinated press releases and posted on NORD's website. Individual calls were held with each of the 31 COE site directors during the month of December. These individual calls confirmed a very high degree of enthusiasm for collaborating with NORD and with the other COE sites. And these calls were also very helpful in building an early consensus on some key points. For example, the site directors each identified a similar list of unmet needs in the rare disease field. And so we were able to decide on a consensus list of working groups, which I will show on the next slide. On the left side is a list of unmet needs for rare diseases that were identified by most, if not all, of the COE site directors. On the right side is a list of the corresponding working groups that we have now impaneled, comprised of expert faculty and staff drawn from the COE sites. Collectively, approximately 200 faculty have volunteered for these 11 working groups. Each working group will begin its work by assessing their targeted unmet need and will then make recommendations to NORD and to the COE Advisory Committee, comprised of the 31 center directors, suggesting which approaches might best be taken to accelerate progress in these key areas. The problems to be addressed include, for example, shortening the long diagnostic odyssey, encouraging telemedicine and intersite consultations as means of bringing expertise to the patients where they are, facilitating multi-site research and clinical trials within the network, and other important efforts such as improving education, training, advocating together to address public policy issues, and improving diversity, equity, and inclusion in all of these efforts. In terms of our aspirational goal of providing help directly or indirectly to all patients with rare diseases in the United States, it's important to note that the US population includes approximately 330 million people, served by 192 medical schools and more than 6,000 hospitals, including 262 standalone children's hospitals. Given our initial designation of 31 centers of excellence, on average, that's 6 medical schools and 198 hospitals for each of the current centers of excellence. Fortunately, each COE tends already to have a regional referral network extending its reach. Those referral networks have developed over many years, and in general, we expect each COE to push some of the network's expert knowledge outward while providing consultations to other hospitals and physicians. This will give the network as a whole a deeper reach and a wider impact. Of course, there's also some room to expand the list of COE sites. Overall, the expertise of the directors, faculty, and staff at our COE sites, as well as their enthusiasm for working together and with NORD, gives me confidence that this network will be effective in advancing and accelerating diagnosis, care, and research for rare diseases. Thank you.